My name is Barbara Lowe Fisher. I'm the mother of a son injured by a vaccine in 1980 and president of the nonprofit National Vaccine Information Center. On April 26th, a national public health emergency was declared by officials in the U.S. Departments of Health and Homeland Security. We were told it was necessary for them to declare a national emergency because people were getting sick from a new swine flu virus that began in Mexico and might cause a deadly influenza pandemic. So far, the vast majority of people who get sick have symptoms that are no worse than the regular flu and recover completely. The declaration of a national public health emergency last spring set a chain of events in motion. Some schools were closed, some people were quarantined, and drug companies were given billions of tax dollars to create experimental swine flu vaccines. These new vaccines are being fast-tracked by the FDA. We're being told they will only be tested for a few weeks on a few hundred children and adults before being given to children in schools in October. Under federal legislation passed by Congress since 2001, an emergency use authorization allows vaccine makers and anyone who gives experimental vaccines to Americans during a declared public health emergency to be totally free from liability if people get hurt. The National Vaccine Information Center has been a vaccine safety watchdog since 1982, and we are questioning the need to turn schools into medical clinics this fall, where swine flu vaccines being rushed to market will be given to children first. We're calling on the Obama administration and state governors to provide solid evidence to parents that it is necessary to give children experimental swine flu vaccines in schools. Are the states prepared to obey vaccine safety provisions in the 1986 National Childhood Vaccine Injury Act, which include 1. Before children are vaccinated, giving parents written information about vaccine benefits and risks. 2. Keeping accurate written records of which vaccines the children get, including the manufacturer's name and lot number. 3. Writing down information in the child's medical record about which vaccines were given. And 4. Monitoring children closely for signs of a serious health problem that could develop after vaccination that needs to be treated and immediately reported to the federal Vaccine Adverse Event Reporting System. Are the states prepared to provide financial compensation to children harmed by swine flu vaccines given in schools? And are parents going to be given complete, truthful information about swine flu vaccine risks and the right to say yes or no before their children are lined up and vaccinated in the school setting? Vaccines are pharmaceutical products that carry a risk of injury or death, and those risks are greater for some than others. 1 in 6 child in America is learning disabled. 1 in 9 has asthma. 1 in 150 develops autism. 1 in 450 has diabetes, and millions more suffer with allergies and autoimmune disorders. Will the swine flu vaccine be safe for them? Although it's a good idea for health officials to prepare for a worst-case scenario and stockpile vaccines, it's a bad idea to turn schools into medical clinics and basically test experimental swine flu vaccines on children first, especially when nobody is liable. That has the potential to hurt children instead of keeping them well. This October 2 through 4 in Washington, D.C., parents concerned about the lack of vaccine safety and informed consent protections will gather with scientists, doctors, bioethicists, and legal experts at the 4th International Public Conference on Vaccination to talk about the science, policy, law, and ethics of vaccination, including the swine flu vaccine. Go to www.nvic.org for more information about vaccines, swine flu, public health laws, and how to make well-informed choices during a declared national public health emergency. Thank you.